Hi, my name is Jenna Schmidt, and I'm going to be performing a head-to-toe assessment for the Advanced Health Assessment class. So I'm just going to start by performing some hand hygiene, and I'm going to be walking into the room to my client who I will be assessing, ensuring that there's privacy, and for this assessment she's in a tank top and shorts. I would have offered a Johnny, but we're not doing that for this assessment. So hi, my name is Jenna. I'm going to be doing a physical assessment on you today. How you doing?
Good.
Can you tell me your name and date of birth?
Lisa O'Brien, 11/8/85.
All right, so I'm just checking her name and date of birth, just ensuring that that is the person that I am doing my assessment on. So how are you feeling today? How's your day been going?
Good. I feel
Yeah.
good. It's been a good day. It's nice
Yeah.
and warm.
Oh, great. Do you remember what you had for breakfast today?
I had
Did you
a
eat
breakfast
breakfast
sandwich,
today?
yes.
A
Yes.
breakfast sandwich, awesome.
Yeah.
So I'm just, testing a little mental status, seeing if she can recall, some of her morning routines. Do you know where you are right now?
Yes. Worcester State University.
All right. Can you tell me the date?
I think it's June 20th.
Yes, good job. All right. Well, I'm just testing her being alert and oriented. She's following commands. She seems pleasant. She's smiling. She does not appear to be in any signs of distress. She seems well kept, well groomed. Her dress is appropriate for the weather outside. So now I'm going to start with the assessment of the head. Oh, first I'm going to do vital signs. All right, so we'll just do a temp. Just do a temperature under your tongue. Right. So that's very normal. I'm going to check her blood pressure. Blood pressure was 110/80. And that is within normal limits. And then I'm also going to be checking her heart rate for a full minute and her respiratory rate for a full minute. So as I'm checking the heart rate, you can also be checking the respiratory rate. So our heart rate was 72 and respiration rates are 16, so that's within normal limits. All right, now I will be moving on to her head assessment. So I will start by just inspecting her head for size and shape. It is round, it is midline, symmetrical. I don't see any obvious lesions visually. So now I will just be palpating her scalp and also looking at her hair to just feel for any lumps and bumps and seeing how her hair is distributed and feeling around her scalp. So palpating. All right, so I'm not feeling any lumps. Her hair looks evenly distributed. It is full. I do not see any hair loss anywhere, so she's got a good pattern and that is appropriate for her stated age. I'm just going to be inspecting her face. So her skin is pink. Her structures on her face are symmetrical. I'm not seeing any lesions again. I'm just going to be touching for temperature, and she is warm and dry, but not excessively dry. I'm going to palpate for the temporal arteries at this time as well. So I'm just palpating to just feel the pulsation, and I can feel the pulsation of her temporal arteries. I'm also going to ask her, I'm going to be palpating for her temporal mandibular joint, the TMJ. So I'm just going to be placing my fingers right in front of your tragus and just ask you to open up your mouth for me and close. So that was a fluid motion. I did not hear any popping. I didn't feel any crepitus or anything like that, so that was a normal finding. And now I'm just going to go over the cranial nerve. So I'm just going to do cranial nerve 7 and cranial nerve 5. So cranial nerve 7 is the facial nerve. Could you smile for me? Could you frown? Could you puff out your cheeks? Raise your eyebrows and close your eyes. So cranial nerve 7 is intact. And I'm going to do the trigeminal nerve now, cranial nerve 5. And that's just testing sensation on her face. So I will just be using sharp and dull. So this is just a feel for it. This is sharp, and that is dull. And I'm going to be testing in 3 spots in her forehead, her cheeks, and her jawline. Do you mind just closing your eyes? And when you feel the instrument, can you tell me if it's sharp or dull?
Dull. Sharp. Dull.
And I would do that on the other side to make sure that it's symmetrical. All right, so cranial nerve 5, the trigeminal nerve is intact. Next, I'm going to be assessing her eyes. So when assessing her eyes, I'm looking at her first. I'm inspecting. Her eyes are symmetrical. I do not see any redness. Her eyelashes are evenly distributed. I do not see any drainage. So from inspection, her eyes look great. Next, I would be assessing her optic nerve. So I'm actually going to be assessing several cranial nerves at this point. There is a group that you can do together. So for the optic nerve, I'm assessing direct and consensual light. So I'll use my ophthalmoscope for that, or I'll use the otoscope just for the light purposes. And I'm just going to be shining a light at the side of her eye to just look and see how her pupil responds. And now by doing this, you can both see the consensual, where when the eye that is illuminated, the opposite eye constricts, the pupil constricts, and then direct when the eye that is illuminated is the one who constricts. So that optic nerve is intact. Another test that goes with this group, there's 5 tests that you can essentially do. I'm picking 3, so that was the light one. I'm also going to be wiggling my fingers in each quadrant, and she's just going to tell me when she can see my fingers.
No.
Alrighty. And for my final test, I am just going to be assessing her pupils. And so I was able to look at them earlier when I was just doing the direct and consensual light. So her pupils were both equal, round, reactive to light and accommodation. So that was my 3rd test to be testing the optic nerve. Next, I'm going to be testing the cranial nerve 3, the oculomotor, cranial nerve 4, the trochlear, and cranial nerve 6, the abducens. And that is testing the ocular, that's testing the muscle of her eyes. And I'm going to be doing something called the H test. So Lisa, I'm just going to have you follow my finger. Try not to move your head, just follow with your eyes, and I'm just looking for any abnormal movements. It should be, a nice, coordinated, smooth movements of her eyes. Great. So she was able to follow my finger great with her eyes, and I did not see any abnormal movements. So that group of cranial nerves are intact. And then for the ophthalmoscope, we're also checking your optic nerve. You could be doing a direct examination of the eye. And so with the ophthalmoscope, which is this tool we have here, you are using this to visualize the structures of the eye. You can look at the optic disc, you can look at the vessels, you can look for the red reflex, which is just kind of a reddish-orange glow that you can visualize on the eye. Alrighty. So next we're going to be, I'm going to be inspecting her ears. So if you mind just putting your hair behind your ears? Great. So I'm just inspecting her ears first. They look symmetrical. They begin and end around the same point on either side. They are pink. They are warm to touch. She has piercings, but no earrings in it right now. And I'm just going to now palpate her ears, and Lisa, just let me know if you're feeling any tenderness. Just going to palpate the tragus. No tenderness? Okay, great. So after that, I will move on to, so I'm not seeing any lesions right now. I don't see any drainage. I don't see any redness. So I would move on to an inspection of the internal ear, and that would be, I would be using my otoscope for that to visualize the eardrum and that pearly gray. And so you have your otoscope here, which you would place a black cap on the bottom of it to just protect it from touching her skin. And for adults, you would want to pull up and back to be able to visualize the ear canal. So you would go into that, you would look, you want to be very gentle, you don't want to use force or push this in there because you could cause some real damage. And you're just looking for any drainage inside there, and just visualizing that the eardrum and visualizing that it is pearly gray and that there's no other abnormalities. Next, you can check the cranial nerve. This is cranial nerve 8. It's the vestibular cochlear nerve, and so this is just testing for hearing. So I would use my tuning fork, and I would be doing the Weber test and the Rhine test. So the Weber test is just testing for hearing bilaterally that she can hear. So I would strike my tuning fork and place it on the top of her head. And Lisa, just let me know if you can hear this in both ears.
Yes.
Okay. Next, I would do the Rhine or the Rin test. And again, I would strike the tuning fork and I would place it on the mastoid bone. And I would be checking for bone conduction and air conduction. Typically, air conduction is greater than bone conduction. And so, Lisa, just let me know when you no longer hear the humming, and I will move it to the front of your ear.
No.
And then I would move it to the front, and she should still be able to hear that.
Mm-hmm.
And you would be timing this, and she would be able to hear, if it was a normal result, the air conduction longer than bone. And I would do that on the other ear as well to just make sure that it is, that she has the appropriate hearing bilaterally. So her vestibular cochlear nerve is intact. Next, we will move on to the nose. So we can just start with the general inspection of the nose. So looking at her nose, you know, it's the same skin color as the rest of her face. I don't see any lesions. It appears intact. It is midline. So just very simple, and I'm just going to palpate her nose. Just let me know if you're feeling any pain. No pain. And then I would ask her to just occlude each nostril and just sniff. And this is just testing the patency of the airflow in her nostrils. So she was able to, her both nostrils are patent. Next, I would be palpating the sinuses. So she has her frontal sinuses, the maxillary sinuses, and then the lacrimal. So I'm just palpating. Just let me know if you're feeling any pain. All right, no pain?
Nope.
Okay. Next, you can transilluminate the sinuses. You would definitely do this if the client was reporting that she was having pain upon palpation, but we're also just going to check this. Ideally, the room would be dimmer, and to check the frontal sinuses, I would have her just close her eye, and I would illuminate underneath the brow, and I would cover it up so that you would be able to see the red shine through the top. If your sinuses were congested, if you had fluid in there, you wouldn't be able to see that great glow. And then for the maxillary one, you would shine underneath, have the client open up her mouth, and you would be able to see the glow inside of her mouth. So just head back, and you would just cup it and be able to see that little red light glow. Alright, next we can check for the olfactory nerve, which is the first cranial nerve. I'm going to do that by having Lisa close her eyes, and she's going to identify 2 different scents for me. If you don't mind closing your eyes. Yeah, can you tell me what you're smelling?
Coffee.
Alright, good job.
Alcohol.
Alright, great. open your eyes. So Lisa was able to identify 2 cents. So her first cranial nerve, the olfactory nerve, is intact. So next we're going to be moving on to the mouth. I'm just going to do some hand hygiene and put on some gloves because you will be doing a little bit of an inspection inside the mouth. So it's just put on some gloves. And first I'm just going to be inspecting her lips. So they are pink. They look moist. I do not see any cracks, any fissures. They are not chapped. They're intact. And when she'd smile, she was smiling symmetrically. Next, I'm just going to ask Lisa to open up her mouth so I can look at her teeth. Looks like her teeth are all present. She has great dentition. And looking inside her mouth right now, I can see her buccal mucosas are pink and moist. I'm just going to bring down her lips a little bit to be able to look at her gums. Gums are pink and intact with no signs of bleeding. I'm going to use my tongue depressor to be able to just observe a little more closely in her mouth. Can you open up your mouth and stick out your tongue for me? Great. So everything is very moist. I can see her uvula is midline. Her tonsils are there. There's no exudate present. They do not cross the midline. Her mouth looks good. At the same time, I'm going to ask you to open your mouth and say ah. Alright, so I can see her uvula is midline. That is testing the cranial nerve 10, the vagus nerve, and it lies centrally, it doesn't deviate to either side. Also, I'm just going to have Lisa stick out her tongue right now. Can you stick out your tongue straight? Alright, so she doesn't have any deviation with her tongue. That is cranial nerve 11, the hypoglossal cranial nerve. And then finally, with the tongue depressor, you can check the glossopharyngeal cranial nerve, which is cranial nerve 9. It's eliciting a gag reflex. All right, yep, gag reflex present. And then finally, I'm just going to use a little piece of gauze to just help grip her tongue and just inspect underneath her tongue to just make sure there are not any lumps or lesions in the texture of her tongue. So you mind just sticking out your tongue? All right, lifting up, looks good. Lift up over there, yep, all righty. No lesions present, and the color is pink throughout, moist and smooth. So that concludes the mouth assessment. I'm going to remove my gloves, and we're going to be moving on to the neck now. So for the neck, again, we just start off with general inspection. So it looks like she has good tone in her neck. Her skin is pink. I do not see any lesions. It is warm to touch, dry but not excessively dry. Her neck looks good. Great neck. All right, we're going to do a little range of motion of the neck. So Lisa, can I have you look up to the ceiling and then look down, tuck your chin. Can you look left and look right? Great, so Lisa has normal range of motion. And did that cause you any pain? Nope. Nope. All right, and she's denying pain, so that is good. Next, we're going to be palpating for the lymph nodes. So I'm just going to be using the little pads of my fingers. You could use 2 or 3 fingers, and you're just feeling for lymph nodes. Lymph nodes can be pea-size, little areas, movable. You're looking to make sure that they're not tender, and so we're going to check several areas of that now. So we have the preauriculars right here. We have postauricular. We have our tonsillar, our submandibular, and submental, and then in the back there is the occipital. So did you have any pain upon palpation?
Nope.
And it is normal to not be able to feel the lymph nodes. You know, usually when you have infection or a disease process going on, that is when there'll be edematous and you'll be able to palpate them. Next, I'm just going to be looking at her trachea. So her trachea, it's lying midline. I'm just going to take a feel. So it is midline. I do not see any deviation. At this time, you can also be assessing the thyroid. So I'm just going to have Lisa swing her legs to the other side so I can just stand behind her. And for assessing the thyroid, you want to place your hands behind them and you're feeling for the thyroid. You can displace the trachea slightly to the left and then push to feel on the right, and then you can do it the other way. And to help with the feeling the movement of the whole thyroid, you can have her take either a sip of water or swallow, and everything should move up together and move down together. So that was good. And did you have any pain upon palpation of your thyroid?
No.
She can turn back around. And if she did have any thyroid abnormalities, such as a goiter, that's something that you would be able to see, and then you could also assess different things such as her eyes and whatnot to follow up on that. And her thyroid was slightly palpable. It was not enlarged, so that is a normal finding. So next we're going to be doing musculoskeletal, and I'm just going to be doing her upper arms to start. So I'm just inspecting her upper arms. She has good tone. She's got freckles. Her skin is warm and dry, but not excessively dry. I'm going to be looking at her papillary refills. We'll pretend that she has her nail polish off, and you're just going to press her and want to see return in the nail less than 2 for the color. Her cuticles look well kept. She's got a nice manicure. I don't see any clubbing of her fingers, of her nails. I'm going to be checking for her radial pulses. You can do this at that time. And for her brachial pulses, you're checking that they are equal bilaterally. You can see if they're faint or they're strong, and just comparing that bilaterally. Next, we're just going to do some range of motion of the arms. So we're going to be doing the fingers, the wrists, the elbows, and the shoulders. So do you mind just putting your hands out for me? And can you separate your fingers and put them together? Good job. Can you turn your palms up, turn them down? Bring your wrists up to the ceiling and bring them down to the floor. Good job. Can you bend your elbows and extend them? All right. And then you want to lift your arms up over your head and to the sides. Good job. So she's got great range of motion, and was that causing you any pain or anything?
No.
No. So her range of motion was normal. We can also check at this time her cranial nerve 11, which is the accessory nerve. So can you shrug your shoulders against resistance? Good job. And turn your cheek against me. Good job. And the other one. Great. So cranial nerve 11 is intact. And I'm also going to check for her brachioradialis reflex. We can check that in her arm. So I'm just going to support your arm, just kind of be limp. And you're looking for the contraction of the muscle, and then there may also be a little twitch in the finger. Just looking. Yep, there you go. So you have a little bit of a twitch, and you would compare that bilaterally, and so she's got good reflexes. And next we will just be checking sensation of her upper extremities with the dull and sharp like we did on the face. So could you just close your eyes and just let me know if you're feeling sharp or dull?
Sharp. Dull. Sharp.
All right, and you would be touching that and testing that in the 3 different areas, and then again testing it on the other arm to make sure that her sensation is bilateral, that she's not, there's not an area where she's not feeling something. All right, so now we are going to go and do the thorax and lung assessment. I'm just going to ask Lisa to swing her legs over the edge again away from me, and we're going to be assessing the posterior chest first. So I'm just looking for inspection. So for just looking at her breathing, her respiratory rate earlier was within normal limits. She's not using any accessory muscles. Her breathing is symmetrical, it's full. She does not seem like she's in any distress. I'm just going to palpate for her skin. She's warm and dry. I don't feel any masses right now. And I'm just going to check for, and I don't see any lesions. She does have a few tattoos. And I'm going to check for equal chest expansion. So you can do this by placing your thumbs at the areas of T9 and T10. And I'm going to gather a little bit of skin in between my thumbs and just ask Lisa to take a deep breath and release. Good job. So I'm looking to see that my thumbs move apart symmetrically and come back together symmetrically, and that not one side is rising more than the other. So she has equal chest expansion. Next, I'm going to be percussing. What you're percussing for is resonance over the lung fields. If you're over a bone or anything like that, it's going to sound flat or dull. So when you're auscultating or percussing, you're following kind of a pattern. So on the back, you're following 8 spots that you percuss through and listen through, and then on the front you would do 6. So I'm just going to do an example of percussion. And that's resonance that I'm hearing over the lung field. So I would continue down into the all 6 locations. and just percussing the lung field. Next, I would be auscultating. I'm sorry, 8 locations in the back. Now I'm going to be auscultating. I'm going to do again in a ladder formation and compare each sides bilaterally. I'd be listening for vesicular sounds over the peripheral lung fields, and her lung sound should be clear. I should not hear any of the adventitious sounds such as crackles or wheezing and things like that. So whenever you feel the stethoscope, Lisa, do you mind just taking a deep breath for me? Good job. Alright, so her lungs sound clear bilaterally. And also, you just always want to remember when you are listening to people, take your time because you don't want to get them lightheaded with taking all those deep breaths. So next I'm just going to have Lisa swing her legs back over, and I'm just going to be inspecting her chest, how I would her back. So I'm just looking at her skin. I don't see any obvious lesions or anything like that. We already commented on her respiratory rate and her breathing effort before. So you would be listening in 6 different places for her lungs on the front. You'd be listening for those vesicular lung sounds over the peripheral lung fields again. You want to start up high. And when you do listen up high, you can hear those bronchial vesicular sounds over the bronchial area. And I'm just going to check her skin trigger while we're looking at her chest. It's just checking her hydration status. So her skin should be able to go right back down. That's great. If it was up, you'd be questioning their fluid status and things like that. All right, so next I would be doing a breast exam. However, I'm not going to be doing that on Lisa. So you would just be inspecting the breast. You would be looking for any dimpling, any discharge, symmetry, things like that. When palpating the breast, you can palpate several different ways, but typically the breast is divided into 4 quadrants, and you can palpate in a circular direction. And you would do that on the other side as well. And you can have the client laying down, and whichever breast you are palpating, have them put their arm behind their head. And it's important to be palpating into the axillary area because that's where the talus is, and you do have a lot of lymph nodes in that area. And the upper outer quadrant of the breast is where a lot of breast cancers can be seen. I'm just going to get the light back on. And then it's also at this time you can provide some education to your patient, and all females and males should be doing self-breast exams. They can do it every month, typically after they have their period, because sometimes they can have some tenderness with menstruation.